if your plan is to get a job after AMC1, then you have to be very careful about your timing of the exam as well. Because what you need to know is most people who get the jobs after AMC1 apply for the hospital jobs. And in Australia, the hospital jobs are recruited through the state campaigns. The largest state campaigns usually run mid-year. And these campaigns are for the next year, which means in 2025, they ran the campaign for jobs for 2026. Now, let's imagine that you did your AMC1 exam just after the campaigns ran. And what you need to do now is you'll have to wait for the campaign for the next year, which will recruit for the jobs the year after that, which means there will be a long gap before you will have your first job. Does that mean that there will not be any jobs after the campaigns? Yes, there will be some jobs, but there will be very few. And so, of course, when you are trying to get your job, out of the few jobs left, it is going to be difficult and you are less likely to get a job because you'll be competing against other people who have already done AMC Part 1, people who have done AMC Part 2 as well. And then there are people who are coming through the competent authority pathway. So because of the wrong timing, there can be a long gap between your AMC 1 and your first job. So what you should do is make sure that you complete your AMC Part 1 exam and your English test before the state campaigns run. So find out first when the state campaigns are about to run and make sure that your plan coincides with that. And does that mean that you'll definitely get a job? No, you may not get a job. And if that happens, you should start preparing for AMC Clinical rather than waiting too long. Because if there is a long gap in your clinical practice, that will affect your recency of practice, and that can have some problem with the APRA registration. So yes, it is difficult to get a job after AMC1. And yes, you'll be competing against a lot of people, but you still have to think strategically and you have to plan in the right way. Now, if you want to find out how you can prepare for AMC Clinical and also get CPD points at the same time in case you don't get a job after AMC1, let me know in the comment and I'll tell you the strategy for that.